Recording started, my Rose.
All right, thank you.
Good morning. Good morning.
Who's that? Hi, Jendrick. Good morning.
Good morning. Aloha.
Hi, aloha, Tony. I hope you're not
Tony.
driving. Are you driving?
I have my phone mounted, so I'll be fine. As long as
Okay.
I don't have to look into the camera.
Don't look into the camera. We don't want to be on the news for this.
Good morning.
Good morning. Hi, Dan. Oh, it's
Hi.
great to see everyone. It's good to see the voice and the face together. Nice. So awesome. We're waiting for a few people from Department of Health. Who do we have we have Telly. Hi, Telly. Tiffany's here. There's Tiffany. And there's our other partner in crime. There's Gloria. All right.
Aloha, this is Carrie with Healthy Mothers, Healthy Babies.
Oh, hi, Carrie. Nice to see
Hi.
you.
Nice to
Nice
see
to
you folks.
Hi, everyone. We're going to do introductions soon.
Okay.
Welcome to our group. And let me see, I just want to make sure all my co-presenters are here. And see if I see everyone. Okay, I'm going to start sharing screen. And then I'll go over the logistics of things. Can you folks see my screen?
Yes, ma'am.
Oh, I get a ma'am even. Thank you. Let's see. So I can see your faces. I'm going to move you all a little bit. Okay, awesome. Well, we're going to start on time because we have a packed schedule. So welcome. Thank you so much for being here. And even on such a short notice, I know you folks were still working on your documents. I appreciate all your patience with this grant. So thank you for all your correspondence and keeping in touch along the process. Welcome to our Community Engagement for Health Equity in COVID-19 Prevention and Mitigation Project. You all have to memorize that title. That is your grant. No, I'm just kidding. Or we call it the Community-Based Organization Grant or CBO grant. Let me advance the slide. So this is the meeting's agenda. As you can see, it is pretty packed. The DOH and HIPHI have a lot of ground to cover, so please bear with us. This doesn't mean this will be your only time to ask us questions. There'll be many more meetings, many more. This will be the first of many meetings to go over the grant and to also provide COVID-19 information as well as we still navigate through the pandemic. If you have questions along the way, you can put it in the chat and Maka will let me know if you have any questions and we can answer them as best we can. Please put yourself on mute and also turn your cameras on if you're comfortable and in a safe space to do so. One last thing, please also rename your Zoom frame with your name and your name of your organization. So you can shorten it, like I'm a bad example. I didn't put Miros de la Cruz, HIPHI. Yes, so let me go on to my next slide. I would like to start with introductions, first with all HIPHI staff, then with Department of Health staff, and then our fabulous CBOs. Please say your name, organization name, and role with the organization. I know there's many of us on the meeting right now. So let me start off. I am Miros de la Cruz. I'm currently the lead for this grant at HIPHI, along with our CEO, Jessica Yamauchi. I'd also like to introduce Cyril Labasa, and she will be our program manager for all the COVID-19 grants here at HIPHI, and she will join us later in our meeting. She will formally start on Monday. So don't ask her questions yet. Monday you can start asking questions. So for our HIPHI staff, can you also introduce yourselves, maybe starting with Jessica?
Morning, everyone. Jessica Yamauchi, CEO of HIPHI. Thanks for joining us.
I go next. Hi, everyone. Makamai Namahoe with HIPHI. I go wherever Jess and Mayro tell me to go. So I'm happy to be working with you folks. I'm probably doing the support with helping you folks with outreach and coordination.
Hi, everyone. My name is also Jessica. I work for HIPHI. I've been with the team since July 2021. I'm a COVID-19 outreach coordinator and I assist at the events.
Hi, everyone. Good morning. I'm Justina. I have the same role as Jessica, so nice to see you all.
Hi, everybody. I'm Becca. I do the same thing as Justina and Jessica, and I'm here to support you guys however I can.
Hi, I'm Ananda Ludit. I'm the Grants and Ops Coordinator for HIPHI, and I'll be helping with invoicing processes and things like that.
Is that everyone from the HIPHI team? Does that look like it? Did I miss anyone? Okay. Okay, awesome. Thank you. I'll turn it over to Department of Health to introduce themselves. Go ahead. Starting with Gloria, maybe.
Okay, good morning. I'm Gloria Fernandez. I'm one of two co-leads from the Department of Health side. My line of efforts is focusing on the operations portion for this contract and grant. Thank you.
Aloha, good morning. I'm Tiffany Lightfoot. I'm the co-lead with Gloria, interim co-lead, I should say, which we'll explain that in just a moment. I'm responsible for contracting, grant reporting, internal and external reporting, and fiscal matters. And I'll hand over to Telly.
Morning, everybody. I'm Telly. I help with the coordination and community liaison. So I'll be helping with the operations side. And I'm going to turn it over. Do we have Michael here this morning? Maybe not. I think we're the only, are we the only three? Okay, I'm going to turn it back to me, Rose.
Yes, thank you. The fabulous three is here. Okay, awesome. So now I'm going to turn it over to community-based organizations, and I'll call you folks out. And first, we're going to start off with the driver, with Tony. Drive carefully, please. Please introduce, if you're with each team. So I'm going to call out your team and introduce yourself and your role. Go ahead, Tony. You're first.
Aloha, my name is Anthony Silva. Everyone knows me as Tony with All Him Productions / The Brothers and Friends. I too help to plan some of the coordination for events, as well as plan the entertainment and working with some of the partners that have been granted these grants that are being given out. So I'm very excited and happy to be a part of this. Mahalo.
Thanks, Tony. Anyone else from All Him Productions? Is that it, Tony?
Not on this meeting, no. I'll be meeting with my staff a little bit later. I didn't want to, make it too complicated for them. So I was going to gather information and then share with. But thank you.
Okay, thank you. Alrighty, so we'll go on with, thanks, Tony. We'll have the East Hawaii IPA. Do we have Susan and her group?
Hi, Susan Mochizuki. Happy greetings from the Big Island, East Hawaii Independent Physicians Association, also known as Big Island Docs, and we represent 65 independent private sector providers in this community. And I'll hand it over to Van, who's also on the call. Van.
Good morning. Happy Aloha Friday, everybody. My name is Van Shimasaki, Program Manager at East Hawaii IPA, Big Island Docs. Just happy for the opportunity. What we're doing is trying to help access for our community as far as, minority access to COVID assistance and care.
Thank you, Susan and Van. Now we have Philcom Cares. We have Manang Amy and Agnes. Go right ahead.
Aloha, my name is Amy Agbayani. Many people call me Manang Amy, which means older sister in Ilocano. My role is being one of the 3 co-chairs for Philcom Cares. And my job is to provide general support for our team. And want to thank May Rose and Agnes for all the help.
Aloha, I'm the second of the triad. I'm co-chair of Philcom Cares, and nice to see many familiar faces here. Thank you so much for this opportunity to work with all of you.
Thank you. We have Healthy Mothers, Healthy Babies.
Good morning, everyone. My name is Sunny. I'm the Executive Director of Healthy Mothers, Healthy Babies. We are so excited for the opportunity to be able to partner with HIPHI again. We have a mobile clinic that will be doing community outreach for families. And we've got Carrie and Vivian on the line.
Aloha, good morning. My name is Carrie Wheeling, and I am the Clinical Services Director with Healthy Mothers, Healthy Babies.
And hi, my name is Vivian. I am one of the program managers with Healthy Mothers, Healthy Babies. Thank you for this opportunity.
Mahalo. We have Kawaii Economic Opportunity.
Good morning. I'm in the little black box, not to be photographed today. I'm Maybelle Fujiuchi. It's real nice to meet all of you, and you're all going to be new friends to me. The only person I know right now on camera is Amy, who I met many years ago. Kawaii Economic Opportunity is the community action agency for Kawaii, and we have several different programs. I was really glad to have the opportunity to participate in this program, and we'll be providing the outreach services for the COVID information and hopefully assistance to the groups that are most vulnerable. We have not hired our staff yet. We will be in the process of doing that. So thank you all very much. Thank you, Miro, so much. And I think with me is Lynn Kua, who's our admin officer for the agency. I'll check the participant list.
Oh yeah, I see Lynn. Lynn, want to give out
so
a
Lynn can
shout, Lynn?
introduce herself.
Hi everyone, this is Lynn. I pretty excited about this opportunity. So thank you, Ms. Rose.
Thank you. Next, we have the Marshallese Community Organization of Hawaii. We have Jendrick and his crew.
Good morning, everybody. My name is Jendrick Paul. I am the president for the Marshallese Community Organization of Hawaii. Here with me, I have Lisa Jensen.
Hi, everyone. I'm Lisa. I work for Jendrick, and I do reporting and writing and whatever I can do to support MCO. Thank you for having me. And thank you, May Rose, for the awesome opportunity. And thank you, everybody, for all your support.
Thank you. Thanks for joining us. Next, we have Molokai General Hospital.
Hi, Punahele Alcon with Molokai General Hospital. I'm a director here, and I have no idea what we wrote the grant for, so I'm just here to listen.
Thank you. I know Janice Kalanihui is our main person, and she was unable to join us. So hopefully she will bring you up to speed when she comes back. Thank you. I hear background noises, so please mute yourself if you haven't done so. Thank you. We have OEV TV.
Aloha kakahiaka kako o wao o na Alehu Anthony no ka'awa mai au ka I ke manawa ewa ma kako o iwi mahe ia. Aloha everyone, my name is Alehu Anthony, formerly of OEV TV. I was the director of COVID PAL for 16 months up until the end of the year. We did a number of things. I think specifically for this call, what's really important is we were and have been supporting the vaccine and testing efforts that Telly and Tony folks have been leading to make sure that there was enough social media presence in and around those events to engage in that way to match what was going on the ground. Really excited to work with you folks in this regard with this next stage in the COVID engagement. And with me, I have Christine Matsuda, who wants to introduce herself as well.
Hey, aloha. Nice to meet and see all of you folks. So I'm joining the OEVTV team for this project as a subcontractor. I'm with Pa'akai Communications, and in that capacity had also been helping with communications for the Keiki Heroes campaign for the pediatric focused COVID-19 communications over the last year and a half and some change. Okay. Aloha.
Aloha and mahalo. Is Bryson joining us?
You know, Bryson had a conflict today, so we'll be giving him the notes. But Bryson Ho, who's the CEO of OEVTV, will also be one of the team leads for the social media aspects and production.
Awesome. Thank you, Na'alahu. Peersuite.
Hey everyone, this is Toby. Nice to see some familiar faces. I'm helping out with the Peersuite team. We're a little unique. We're building some technology to be utilized by community organizations, and we have some in the pipeline, but of course are always looking for more. The technology is going to help anyone better assess and address some of the social drivers of health related to vaccinations, but also some of the other things related to vaccination access, health literacy, and transportation, things that we know could be barriers for vaccination. We have a pretty big team, a combination of engineers, program staff, about 7 full-time community health workers and a bunch of part-time community health workers as well. So we have a pretty diverse and expanding team, and looking forward to working with all of you. Thanks.
Thanks, Kobe. We have Project Vision Hawaii.
Hi, this is Teresa Gary. I'm calling in from Maui where I work with Project Vision. I only do their writing and reporting, but I believe Dara was going to try to come online if she could. But anyway, Project Vision does mobile health outreach, and we're happy to be part of this endeavor.
Thanks, Teresa. Partners in Development Foundation.
Hi, aloha everyone. I'm Laura Dang. I'm with Partners in Development Foundation. I'm the Vice President of Administration, and working with my team co-lead over here, Allison. So Allison, you want to introduce yourself?
Aloha, my name is Allison Masutani, and I'm the VP of Operations. Aloha, and thank you so much for this opportunity.
Thank you, Allison and Laura. And also another lead would be Sean.
Yes,
Yeah,
she's unable to join, but she's our president and CEO, Sean Kanayopuni.
Thank you.
Hello.
And last but not least, we have We Are Oceana.
Hi, good morning, everyone. Thank you so much, Mayor Rose, for this opportunity, and HIPHI. It's really nice to see familiar faces. It's encouraging that we're going to have another year of wonderful collaboration. These are the same people that did the work for COVID, and I see a lot of you here again, and I'm just feel very blessed to be in this space again. Did I say my name? My name is Josie Howard from We Are Oceania. I do the grant management and with other partners that are not here today, but maybe will be in the future meetings. Thank you.
Thanks, Josie. Before I move on to our partners, Department of Health. So this is, sorry, let me go back. This is everyone in a snapshot. So there's so many of you, there's 12, the mighty 12 here. And then, so you all will get a contact sheet with everyone and whatnot. And you all will get familiar with everyone, and hopefully there's partnerships at the end. So this is everything in a snapshot. So that's, you know, many of you are doing statewide, some of you are just doing specific counties, specific populations, and some are doing health promotion, some are doing the vaccination clinics, outreach and education. So everyone has a particular role, and hopefully we all could partner and support each other to make a whole, right? So if you're over at Ka'u, if someone's doing a vaccination clinic, someone else could also provide health promotion, interpretation, and whatnot. So hopefully we can work as a unit and help each other out as a team. So this is the last 4. Yep. So hopefully we'll get you the information out too. But now I'm going to turn it over to Department of Health. Thank you all for the introduction. It's great to see you. Oh my gosh, this is so wonderful. And hope to see you all down the road when it's safe in person. But go ahead I'm going to share it stop my sharing and I'll turn it over to Tiffany.
All right, thank you. And I will get my share screen up and going.
Sorry, my mouse is not working.
No worries. How's my volume? Can everyone hear me okay?
Yes.
That works? Okay. Okay. So we want to do an overview of the grant. And this, feel free to interrupt me if anyone has questions, and we'll have time at the end. This is going to be a very fast overview. And again, a lot of it is telling the story that so many on this call have been doing for many months during the pandemic. So first and foremost, from the Department of Health, we want to say thank you. This task was absolutely impossible without your work and your efforts. And we're very grateful to be able to now to continue the funding and really advance this work. So as May Rose mentioned earlier, this is a community engagement for health equity, COVID-19 prevention and mitigation. Big mouthful, that is the official title of this contract. Myself, as introduced earlier, I am Tiffany Lightfoot. I'm a registered nurse in the EMS and Injury Prevention System branch, and I'm partnering with Gloria Fernandez, who is a registered nurse with the Public Health Nursing branch. And we're going to talk a little bit about our role and why we were added to the team in just a moment. What is important takeaway, which I'll dig into a little deeper in a moment as well, is this is a federally funded initiative where actually Department of Health had an opportunity to use funding from 2 sources through both CDC grants. One is the immunization and vaccine for children. And that is significant because you all know children do not make vaccine decisions on their own. And so this is why we will need to target the entire family unit for that decision making to protect our keiki. And then secondly, this initiative is being funded by the National Initiative to Address COVID-19 Health Disparities among populations at high risk and underserved, including racial and ethnic minority population and rural communities. And I think that is a lot more, we've talked more about that grant funding stream because this is really putting to the power for all the work that everyone on this call has been doing during the pandemic. So the purpose, the overarching mission is to address COVID-19 related health disparities. And to do this, we need to develop and continue to expand capacity so we can prevent COVID-19 infections. And we're particularly focused on the higher risk and underserved populations. And our method for doing this is partnering with you all, the community-based organizations, to deliver innovative strategies. And we do have a particular focus on vaccination. So I want to talk a little bit about the timeline. The big takeaway here is this specific contract does not have a long timeline. This was awarded over the summer from the CDC and the second grant. And the first grant for the children has been ongoing for years because CDC is always working in that territory. So this contract started December 1st. Myself and Gloria were added to the team early January. Department of Health needed to do a re-strategy in terms of how the department was supporting this initiative. So I think to you all, it may feel like this grant really got kicked off in January, and that is because the Department of Health, we had to do an internal shift and adding the nursing support. The reason for that is because Gloria and I, in our primary positions, we're used to building sustainable systems that focus on health literacy and across the continuum of care. And that was what we come to realize and why Gloria and I were added to the team. Our roles are temporary. One of our responsibilities for that sustainability is also building the permanent team that we will hire, train, and then hand off to, and we'll be doing all of those introductions along the way. So again, the takeaway is that we have a short timeline. So the month of February, you all were super busy writing RFPs, signing MOAs, and we have been doing weekly meetings and even more with HIPHI, meeting with the FQHC, so everything's coordinated, meeting with our CDC partners in outlining the pre-approval process, which I'll share some more information on, and then also creating the database for our data reporting, because we want to make sure these tools are easy to use for our accountability to the federal government. So what we're going to be seeing in the next month is we will be meeting with our district health officers. We want to make sure all of these activities are coordinated with the Department of Health district health officers, since they, from the Department of Health, were leading efforts for Kawaii, Maui, and Big Island. And also, we're going to continue to meet with you all to talk more about our health literacy and the events, all the work that you all know Telly has been doing. We're going to be handing off a number of that great work that she's been doing. So we're going to get you trained up. Also going over the data reporting requirements and the invoicing, so we have efficient throughput for those reimbursements. And then last but not least, we'll be processing any CDC pre-approvals if there are requests for participant incentives. This contract ends on November 30th. So this is all right now stuff, which you all know. There is an opportunity to extend for 1 year. The department and HIPHI and you all that'll be an open discussion if that is needed, or if we're successful in exhausting all the funds by November 30th. So I mentioned that there's 2 funding streams that is supporting this work. $8 million is coming from the immunization and vaccine for children, and $500,000 from what we call the Health Equity Grant. And so we are reporting to 2 CDC entities, but it's a shared mission, and we just want to make sure that we're very transparent in knowing where the funding streams are coming from. The Health Equity Grant, as everybody, I think many are aware, it's very big and very complex. There's over 24 initiatives, or priorities, strategies, they're called strategies, over 24 strategies. And so we just wanted to lay out where this body of work lays in the strategy, which is underneath the DOCD, the Disease Outbreak and Control body of work under Dr. Sarah Kimball. We want to share an org chart within the Department of Health. So as we've shared, Gloria from Public Health Nursing is on the operational side, and I am on the fiscal and reporting side. Telly, basically we do everything that Telly says because we're formalizing all of this great work for the last how many months. And we want to do honorable mention to Lieutenant Colonel Jason Iomasa. He's a registered nurse with the Hawaii National Guard. Hawaii National Guard is no longer supporting us because their services have ended, but they did a lot of work in building that medical library that Gloria will be talking about. This is a snapshot of the database that we've created for the data reporting so that we can make sure we're accountable to the federal government. This is within the Department of Health portal. Once we have all the MOAs returned and we can see exactly what those budgets are for, we anticipate we'll be adding a few more categories because we want to make it sure that it's very efficient, minimal necessary for us to do all of our accounting and reporting so the invoices will stay smooth. We'll open up another training session for how to do this, but the takeaway is we're really working for minimal necessary because everyone's already overloaded and we want to make sure all the energy is really in the field and advancing the mission. One comment, and this is still being worked out, is we know that with our focus on vaccines, how do we capture that? And our goal is we don't want to put anyone in the position of trying to track data for another entity. So we are strategizing how we can optimize the Hawaii Immunization Registry to assess vaccine uptake in the setting. And so we have some really solid strategies. Considering the timeline is what we need to make a decision now if we're going to be opening up a field that will track the vaccine uptake at these sites. But we'll communicate that because we want you to be sure that you all know what the vaccine providers will be doing, the testing providers, and how that data reporting is going, because we want to make sure that we have closed loop communication so you all can see the impact of your efforts. So a couple of comments on the budgets. So in our pre-conversations, we know there is a big interest in providing participant incentives. We know that's how we bring folks to the table and how we can have these health literacy conversations. CDC it took them a good while to figure out how to get their arms around this. And because this is nationwide that we're all tackling this issue. So CDC developed a process for pre-approval for participant support costs. As we get the MOAs back and we see exactly how funds want to be expended, we'll be facilitating those pre-approvals. What I want to offer here is our CDC counterparts have been very supportive, very responsive. We do not anticipate significant delays if any pre-approvals are required to support participant activities. So I just want to run you through a couple more slides. This is probably telling your story for all of you who have been out there. This really is the body of work that Telly has been coordinating in this space. So the overall mission, what we're trying to maintain is the community outreach vaccine testing and what do those events look like. So right now, I think the biggest concern is with the FEMA reimbursement going away, how is Department of Health going to support vaccine and testing providers? I personally hope we have a final answer come next week. We are meeting a lot and looking at how we can continue to support this. Once that final decision is confirmed, we'll be communicating to you all so you will know who is available for a vaccine testing provider. Over-the-counter self-test kits is a great opportunity, I think, that everyone has recognized for this space. And so HIPHI has been submitting requests for self-test kits to the Department of Health. Since we do have funding available for these devices for the test kits, we wanted to preserve the funds for this work. So so requests are coming into the Department of Health, we're getting approvals, and then we're doing drop shipping so we can distribute through this avenue. In language and interpretation is significant. And this is why we wanted to make sure that we provided funding to maintain the successes we've seen over the last months with having folks on site to be able to have those meaningful conversations. And of course, the health literacy and outreach, which some are face-to-face, some are virtual, but this is all covered underneath this scope of work. And I think the most exciting part and why this has been so successful is the cultural engagement, the health education, and the incentives. We know when we offer something that brings folks to the table, and that's what we foster trust. I think previously we were using words like entertainment and gifts because it felt good, and that's how we were able to have these conversations. I think if anything, my only role in this was to be a translator, to say it's actually not entertainment. I mean, just because you're having a good time doesn't mean it's not meaningful. And we really were able to find out this is health education. And by labeling it exactly what it is, that is how CDC was able to say, yes, we absolutely support this. Furthermore, while it feels like a gift, that is not a word that the CDC is in their vernacular, but incentives is. And so when we talked about the purpose and what the type of things that the CBOs wanted to hand out or continue to hand out, CDC was like, yes, we do support health education and incentives, and I'll be helping and making sure our language is translated so we can sustain these efforts because it is viable, it is meaningful, and we just don't want to get a denial just because we're calling it the wrong thing. So that's what I hope to contribute to this team. And then marketing, we know we got to tell people what where to go and how to get there. So that is all covered, and that's print, radio, social media, and any of the tools. I heard there's some technology folks on the call, so thank you for your efforts there. And then to get it all done, we have to have the venue, volunteers, and equipment, and that is all covered. One honorable mention for volunteers, because we know a lot of folks were just all hands on deck. Now, this is an opportunity for those volunteers to be compensated for their efforts. Again, that's a translation with the CDC. So being able to compensate folks, we then call them members and we can pay for their services and all their efforts. And so you may see some words called a little differently, and then we'll communicate all of those. We want a resource, and sometimes we just have to just switch the words a little bit to honor that work. And then last but not least, one of the primary missions of this is to connect community members to all the resources that they have available. So whether it's food distribution, healthcare referrals, or social services, you all saw how successful it was to be able to bring all of these community resources and agencies to one spot for the community members to be able to get connected to things that have existed in their communities, but maybe they just didn't know about it. Or perhaps the pandemic presented a situation where they now needed to take advantage of it. So our mission is to bring all of those resources to a centralized location so we can get community members connected to the things that are available to them. So that is a very fast overview. Please ask questions. I'll probably defer to Telly, but I should probably be the one asking questions because this is really telling the story for what many of you have been doing throughout the pandemic. So we just want to say thank you.
Do we have any questions for Tiffany now? Thanks, Tiffany. Or you can put in a chat. But there'll also be other times like we could schedule a meeting together and to cover certain questions, especially regarding your incentives and the wording, the jargon. I'll be your translator on how to translate and put it on the forms and whatnot. I think in the end, I'll have to meet with you all individually to cover how we should word things so that your work is reflected and it's translated over correctly in the forms and the reports that we do. So it's all grant. That's part of grants, you know, how we do grants. And sometimes it's not very, you know, easy or convenient, and we have to use the right terminology. So I apologize for that, but we're going to help you along the way. Gloria, are you ready for your section?
Sure, I'm ready, and mine is, there's no PowerPoint or anything. I'll just go through it really quickly.
Gloria, you muted yourself.
Oh, sorry. Sorry, Gloria.
I am so sorry. My computer is flashing again.
No problem.
Okay.
Before you start, Gloria, sorry. Can Naalehu, you had a question? Sorry about that.
Just a quick one, you know, and thanks for taking the time on this. You know, is there going to be a section in the reporting, or is there a standardized way at which you want metrics other than people served that come from either social media or broadcast metrics? You know, we've done this a number of times with other federal grants, whether it's ANA or NHEP. Where the reporting metrics were customized because of the fact that we're in broadcast and in pushing on social media. Just want to make sure that we get that kind of tied down now so that we can kind of draw a fence around what numbers are needed as we go at the start so that it all makes sense for the reporting metrics.
Yes, absolutely. And I really appreciate that question. Once we get all the MOAs returned, that we'll be able to, on the data reporting form that I shared a screenshot of, we'll add a couple of additional fields. So knowing that we will have that social media presence, we absolutely would want to track that. And being that this is your area of expertise, if you have recommendations on that reporting, that would be fantastic, and we would appreciate that.
Yeah, absolutely. We can do that. And then, you know, just one more question, and I'm sure this is going to come up, you know, in this conversation, but I do want to have kind of a more robust talk about how it is that we are going to engage in some of this work, given the fact that so much has changed since even when we wrote the grant, and how the county and state policies that are shifting dramatically and quickly are either going to like shift the expectations of what we're trying to do with this grant or broaden some of the work. I saw a couple of slides in there that actually kind of speak to that, but I did want to get some ideas on and some feedback from you folks as to what that means to you guys at DOH and HIPHI, and how it is that we as community partners can respond and engage.
We are all asking that same question at the same time, let me tell you. And what's going to be most meaningful for us, the three of us, CBOs, HIPHI, DOH, if we can create it together, that's going to be the most successful. You all are on the front lines, you're in the communities, and that is what advice you all have will be very, very valuable for us as the DOH. So I guess I know there's a next steps on the agenda. So if we can circle back to that specific question under next steps, because the quicker we can identify that, I think we're going to be successful.
Okay, mahalo nui. Thank you.
Thank you, Naalehu. Yeah, I think we can write our own playbook, right? I think a lot of times we've never incorporated the community voice, and I think this is the perfect opportunity to write it all down and offer a framework on what we did in Hawaii to help our community. So I think there's a lot of opportunities here, and hopefully we can pivot along the way, and we'll do the best we can together. Yeah, we'll have more discussions about that. Thank you. Okay, Gloria.
Okay, I'm going to be quick and to the point with this. No PowerPoint, no nothing. Part of what we have learned throughout this pandemic is what worked and what didn't work, what we were successful at, and what wasn't so successful as far as implementation, layouts, programs, and things like that. So that's one of the things that we're looking at. Telly has already created some pretty great information, PowerPoints that can be shared with all of you folks. That's one portion. The second portion is a resource library that we are reference resource library that we're working on that provides information or just a quick link to information that may be out there. Most of you have probably used a lot of the information or been to these sites. So it's more of a reminder that there are things already out there for you folks. And if you're creating things that can be shared with the other CBOs here or the organizations, by all means, we can also put it up onto this one resource library to be able to share with everyone. One of the things, and then the third thing, sorry, is what platform are we going to share all of this information on? The Department of Health does have a platform that we're considering on and using so that everyone can have access to, where we can post, where we can upload whatever PowerPoints have been created by Telly so far, and the reference library so that you folks may have access to it. But we do need to hear from you folks on what you feel maybe gaps that more information may need to be obtained, or how we might be able to help you. Maybe if you're working with other community members, how we might be able to help you on training needs for other community members, because we are looking at this kind of a train the trainer type program. You know, if you're working with others, what is it that you're working with them on? How are you training them to be able to come on board and do this? And so we do need to hear from you folks. Rather than kind of take the time to go through it all now, I am going to request that May Rose, HIPHI, can you guys go ahead and collect the responses? If you have any training needs, if you can get it over to HIPHI by next Friday, which is the 18th. Because we do need to, we need to understand what it is that you folks need and not assume that we know it all. So please, if you have any resources or materials, collateral that we already have links to, we want to hear about it and we can begin to gather this stuff and put it together. But other than that, that's all I have. Thank you.
Thanks, Gloria. Let me share my screen again. Can you folks see this fine? Yes, thank you. Okay, so just wanted to cover a few things. Yes, we will share the slides with you folks, and we'll also share the recording. I know some of your members may not be here, so you could actually share the recording with them. And then, you know, if you're already, and I think many of you are, and you all have been doing this with me, if you want to do individual Zoom meetings, like make an appointment, and we'll do that to go over a little bit more about your contract once after we get the MOAs going. So yeah, so that's a different set of meetings apart from this one. So I wanted to show you this slide about the meetings. And what you see here first is that this circle, this ring. So HIPHI has many responsibilities for this grant, but I wanted to just highlight the main three. One is you folks, the community-based organizations, and you're the grantees. We also have a community health centers. They have a grant application that's due today. So we'll be working with them on their grants also. And then there's a translation component, and I'll go over that in the next few slides. But this is what we're covering with the funding we got from the Department of Health. So, so we'll also give you a contact sheet of Department of Health and HIPHI's list of contacts. If you have any questions specific to fiscal and invoicing, we have Ananda there if you have, but I'll be your main contact for now until Cyril gets adjusted and we break her in. We'll kind of hope, co-lead each other with this grant. But until then, we'll also send you links for forms, reporting, and events. You'll have your own link, and then I could train you on that. And we're hoping to put that on Airtable, and you could navigate through whatever you want. There'll be like a menu on how if you're gonna submit a request for the COVID test kits. So hopefully it's a simple form. And once we get that form, we'll contact you and tell you like, okay, you can get your test at this time and that time. So hopefully that's seamless and not too cumbersome. And if any questions at all, you could also email me. So now we're going to the content for the meetings. So some of you were part of the Department of Health COFI grants, and we met every Monday to get information about COVID-19 messaging and information from Department of Health, but also get up to speed on what other CBOs are doing. We wanted to do that for this group too, but wanted your feedback and just have a short discussion, less than 10 minutes, on the best day of the week. Would you rather have it be every week, every 2 weeks, 1 to 2 hours? Is there a particular time you would like? And you can put your answer in the chat or unmute yourselves. How is that? Like, we could continue on with COFI because I know the COFI calls won't be happening anymore. For those of you who weren't part of COFI, it's just a Department of Health had a bunch of had grants, just like this one, but on a smaller scale to help support vaccination and outreach efforts, and everybody met weekly. So yeah, so I'll stop talking, but is there any preference for anyone?
Can I ask Mayrose and
Yeah, sure.
Maka, how easy is it to launch like a quick poll on Zoom right now to see if folks can respond if they would prefer a weekly or bi-weekly meeting, and then maybe 1 hour, 90 minutes, or 2 hours?
Right. I think we were, I don't think we can do a poll right now. I think we were supposed to set that up right before the Zoom meeting, but people are putting in chat.
In the chat, yeah.
Yeah, I see bi-weekly, so every 2 weeks, 1 hour, every other week. Yeah, okay, so every other week.
Bi-weekly looks good.
And
for an hour.
Every week, the rest bi-monthly. Yeah, so we'll do the bi-weekly for 1 hour, see how that goes. And if something changes, there's a new variant, there's more vaccination needed and whatnot, we'll work with you all to see if we have to have more messaging or more events, and then we can see if you have to decrease the amount of meetings or increase the amount of meetings. I know we all love meetings, and hopefully, it'll be through Zoom. We'll share the platform on Zoom, and then we'll see from there. I see Kobe's utilize Slack. Yes, yes, we use Slack. We'll try. We'll see how it goes. I think we have to have more discussions on everyone's comfort level on how much they want to be updated with things. But yeah, we'll have another meeting about Slack and whatnot, Kobe. And my question is, okay, any preference for the time of the week or day of the week? Sorry. Monday to start it off strong, start off the week strong, or is it too much? Any preference? Morning or afternoon? No? Monday PM, na'alahu. Early in the week is important. Okay, Monday PM. Okay. Either 1 or 3. Okay, so PM being after 12 PM. Is that okay? Yeah. So you already had your coffee. You're not hangry by the time we get to our meeting. Yes, I like that idea. Okay, so let's, and I can also do a doodle poll too, if that's preferable, but let's try it out, yeah? So let's see where we're at. So I know a lot of you still have to do your MOAs, submit some forms. So not this coming Monday, but hopefully the next Monday. Let's put that on the docket now for 1 p.m. But I'll also send out an email to follow up and just to see where we're at with that with all the reps. So please put that down. I don't have my calendar out, but you folks are priority. So you're on my schedule for the following Monday. Not this coming Monday, the following Monday. Okay, and then we'll follow up with that. So thank you so much for all your feedback. After 2 p.m. preferable. Okay, well, we'll see on the time and we'll work it out with each other. So after 2. So like 2, so Sunny, 2 o'clock or after 2 o'clock?
Sorry, either I saw Josie's response and I was like, yeah, that would be a little bit more breathable for us as well, because Monday mornings there's always so much going on. And
yes,
then we can kind of
okay, I get
organize.
It. Yeah. Okay, let me get my date book. So Monday, here's a, okay, 2 p.m. Jess, do you want to do 2 p.m.?
I'd rather do 3 if we can, because we have a standing 2 p.m. now.
Oh yes,
Meryl.
we do. I was supposed to be at that 2 p.m. meeting. Okay, 3 o'clock, going once, or I feel like an auctioneer. Going once, going twice. So we will do to the next, it's not this coming Monday, and it's spring break. I'm sure you all have your kids around. So maybe the 21st at 3 p.m. Let's put it down for now. Is that okay with you folks? Yes. All right. Let's pencil that in. I'm going to pencil that in too. Awesome. Wow. That was easy. I like this group already. Look at this. What else can we do? Let's solve the world's problem. Anyway, that's the next meeting. All righty. We have 3 p.m. the 21st. Thank you. Okay. Upcoming events. So there's another form. So what we would like is to just, I think what we noticed, and I truly am grateful for all of you folks when you were doing your vaccination events, outreach events, but I think many of us were just doing it in our own way. So we're trying to connect everyone. So we're going to have a link that you can fill out if you have events. So dates and time, it could be any event, your vaccination clinic, test distribution, outreach activity, pop-up community event. And then in that form, you'll also be asked if you need support. Like you can say like, yes, I do need support from maybe all him for the health promotion, for the music and whatnot, or if OEV can be there, or EV will need people to volunteer or not volunteer, to talk about or make a PSA, do a messaging, right? So this is a good time to put it in the form and we'll connect everyone. And hopefully we'll have a master calendar so you can all see the landscape. And especially for those on the neighbor islands, if you want more support, some of our organizations here are statewide. So they could help, some would fly over or they'll reach out to their partners or their satellite organizations there and have support for you folks. So hopefully we could see the map and see it on a grander scale and just connect everyone and see where people need support and not duplicate efforts. Like if everyone is planning to do a vaccination event in Waipahu and there's 4 of you, then you'll probably not have a lot of people show up because everybody's spread out. So maybe we could help coordinate an event in one place with all of you folks and have a bigger bang for the buck, right? Have more people show up there. And this would be a great place for dissemination of information. So I'm using the Philcom Cares here for like a flyer. So please share your flyers with us and we could share that out. Just like Gloria was saying, the resource library, we could do that, or just share with everyone. And so we could share the information, get it out to our networks, especially if you have materials too, if translating materials, if you will have some, anything, just let us know and we'll try to get it out to all the CBOs. Any questions about that for now?
Hi, this is Na'alahu. Maybe just a comment rather than a question.
Mhm.
You know, one of the ways, right, we should acknowledge that some of these events are really timely, that they're tight turns on when these flyers are produced versus when the event is. And we try to have enough days to promote, but it gets really tight. But also that we don't want to bombard. Well, when we're running COVID POW, I didn't want to bombard partners who didn't have like anything to do with, you know, like the Waipahu engagement that you were talking about, if they were outer island. And one of the ways that we thought that it worked pretty well, and maybe we can get some feedback from some of the folks who are on those email lists, is that we did like a big kind of choose your own adventure data dump of all the different products that we could get our hands on as COVID POW across partners. So there were like, I think in the end, there were probably 7 or 8 dozen partners in different buckets. So everything from for-profits to healthcare providers to community groups, and we would send out like twice a week. I think some of you may be still getting those from Le Maile, or they get pushed on from Telly or others. And you know, if we can centralize where all that goes, we'd be happy to expand that network, maybe retool it specifically for this, and then take all of the material and then send it in an email. The reason why we like that is because, one, it's like almost forced upon you. You don't have to go to a website, it's in your inbox. And then 2, you can scroll through it very quickly and be like, oh, that's in my community, or oh, this is something that we should push out. And then you as a partner can take it and then push it to your own listserv. So it's kind of democratizes the way at which you can choose your own engagement as a community group, depending on where you are or who you serve or how all that works. And it's not perfect, but considering kind of the scale and the depth and breadth of what we're trying to do, it did work, I think. And if anyone else wants to chime in about that, but we'd be happy to help to continue to do that as part of what we're trying to do with social media and broadcast and all of that.
Thank you. I appreciate it, Lehu. Anyone else? Anyone has any questions about that? HIPHI has a pretty robust newsletter system, and we do have, we've been having emails. And so here it is, here's another form, right? We'll make it easy, really honest. You'll have like a menu. And so in that form, this is just right now in the very beginning, we just wanted to ask you if there's anybody in your organization that you wanted included in the listserv, or who would be getting all these emails, right? So maybe it's certain members of your team and whatnot. So we could help with those buckets too. But instead of, like Lehu said, you know, bombarding everyone with a lot of things, we'll try to synthesize everything so that you can navigate through that email to see where everyone is at, what dates and times. And of course, you could also reach out to each other if you want support or if you have any questions regarding an event with that organization. Thank you so much. Okay. Regarding partnerships, and Tiffany covered this really well. We do have partnerships with the FQHCs and the district health officers. And the reason is what we noticed with the pandemic is everyone was pretty much doing their own thing. Community-based organizations were volunteering. Everyone was like, I know my community well, I'm gonna put in my language. And then we had the medical facilities doing their vaccination. Everybody was just bombarded, inundated, overwhelmed. And so what we're trying to do is connect them all together. So with the FGHCs, or the federally qualified health centers or community health centers, we're allowing them to also put in a grant application, and we'll fund them for a small amount for any outreach activities. So I know they've vocalized that they've just been so overwhelmed with a lot of people being sick, getting treated at the community health centers, but also vaccinating them and testing them. So we wanted to also offer them support and tell them, if our CBOs are having an event, you could actually send your patients there to get tested or to get vaccinated. But at the same time too, if you have translated materials, we could send them over to the FQHCs to give to their patients who really need the in-language materials. So we're trying to make it it's not perfect, I know, but we want to make sure that we connect each other and establish or strengthen partnerships. So we get all used to like the lay of the land and who we could connect over at Maui and who could we connect over at Molokai, but we have connections. We're not trying to overlap or step on anyone's toes, but I think there was just no connections a lot and everyone was just fending for themselves. So we're just trying to help mitigate that and establish these connections. The district health officers over at the different counties, they are there to support the different counties. So sometimes they want to just get information, who's going to be in their neighborhood and how they could help facilitate the events, support the events, or get it out in the community. So that's why we have a different, we're not funding them, but we're just coordinating with them a little bit more, and we will be meeting with them. So all of this is to, like I had on the slide, decrease duplication, increase what we have, so amplify, right? Amplify our vaccination, testing, and outreach efforts, and having the support and establish and strengthen partnerships. You know, we're in Hawaii, yeah, we're all kind of related to each other somehow. So we're gonna, you know, make sure that we're gonna talk with each other, make sure we support each other, and just have conversations that we've never had before. So making sure that we have an understanding and having just the support for all our needs, yeah. So we'll keep you updated on who the FQHCs are. So once today is the last day for the application. So once we identify them, they go through the same process as you know, hey, something's wrong with your budget. We have a few questions about your budget. Same thing, we'll give them a week to see if they want to accept the award, and then also work with them and then do an MOA. And then hopefully with the different neighbor islands, we'll connect you all to your matching FQHC, or if you're statewide, to also give you the lay of the land for community health centers. Does that make sense? Anyone has any questions regarding that? Nope. Oh, awesome, thank you. Okay, so yes, we have COVID test kits. So when we did the application, and before that, that was the number one question. And I really apologize that the COVID test kits didn't come sooner, but we have them. So we will have another form, yay, for you folks to submit if you need test kits. So at HIPHI right now, we have a little less than 25,000. We are over at right across from the main post office, not the main post office, the downtown post office. But if you're on Oahu, I'll be there on a Wednesday. If you can pick up in the afternoon, let us know how many you need. So they are in boxes of 300. So think of that. We're not going to open the box and be putting in no baggies for you, because they only come in one each. So we're going to keep them in the boxes for easier transportation. So keep that in mind, just batches of 300. So think about that. If it's over 4,900, you have to submit a request. So like someone's going to order 20,000, you have to submit a request to me, and then we'll probably deliver it to your one location, one address, and then we'll work it out with you folks. If you're in a neighbor island, we'll ship it to you. So let us know how many you need. I know some of you put that in your budget, but the Department of Health will be giving us our COVID test kits. And along with that, of course, we need your help to help track numbers. So who did you give it out to? Not like their names, but how many? Was it a particular event? Was it a particular population? Stuff like that. Those are reporting and tracking that we need to report to the Department of Health and to CDC. And then also what we're trying to create is there is a standardized material that we're going to give you folks. We're going to give you a QR code. So it's up to you if you want to print it out, but it's a Department of Health material that has on when you should take the COVID test and how do you take it. We're also trying to translate it. So I know for the Filipino Marshallese communities, That would be so helpful, yeah, for your community. So hopefully there's also a QR code for a video that they could see. But we wanted to make sure that we have these materials ready or soon to be ready. We're still working on them for you folks to give to your communities with the test kits. So we have them now, and we're gonna, probably next week, we're gonna send you the link to put in your request. You could put in your request already. Some of you already told me how many test kits you have. We just have to organize when you folks are coming to pick it up. So we're on the 6th floor. So bring your whatchamacallit, your strong women and strong men, and have your vehicles ready to transport. So we'll work that out with you folks. Any questions regarding the test kits?
Rose, can I ask a question?
Sure.
Based on what you've just gone over the last 3 or 4 minutes, do you feel like this testing regime is like the path forward with respect to community engagement, given the drop-off for vaccines? Is that kind of the perspective?
I think it's another option, because we had the free 4 per family option, and not a lot of people had that. Yeah, and some people couldn't even order, or it wasn't an easy access. So so I think because we're going to take off our masks, we're opening up the schools and opening up a lot of things. We don't know what's going to happen, but we wanted to make sure we armor our communities with these test kits. It's not foolproof, or fail-proof, but we want to make sure that at least they have this, so that they know what else to do should they quarantine as a family and whatnot. But we are hoping that you folks also relay messages like, okay, you have your test kits now. Make sure you help each other out. Make sure you have the right messages until we know. I know it's a little late. I wish we had the test kits before, but this is where we're at. But at least now we have a source. Tiffany, go ahead. Do you have a comment?
Sure. I was just going to do some co-signing, really. And I couldn't see because my screen, I think that was Naalehu.
Yes, it was Naalehu.
So I actually, that conversation and that thought, I've heard a lot in the last couple of weeks, and I think the answer is yes, but I would actually ask you and everyone on the group the same question. If you think this is going to be the avenue to have these conversations, I think that's the hypothesis on the table, and that's what we've been hearing. I've been hearing it through Telly, which Telly's been hearing it through the CBO. So I think we're all on the same page. So I think that is a pretty hard yes. But if you or anyone else on the call can confirm that from the frontline perspective, that would help build our confidence that we're doing the right thing.
Yeah, I do think it's the right thing to do. And I think that what we've been working on the last several weeks, and just in terms of how it is that we're going to engage with this shifting landscape, is that what we're trying to do is say, like, look, we're open. You can, engage again. You can get into these large groups, but what we're asking you to do is just tweak some of the ways in which you do it, and consider these things depending on how large of a group you're going to be in, or whether or not we can approach small businesses to say, like, hey, would you agree to test once a week, so that we have these gates up in these various places where we can kind of maybe stop the spread if we get 1 or 2 cases and we know it early. So I do think it's a credible idea, and I would love to hear from some of the other people in the group, because I think what it's going to take is like kind of general acceptance. Like, everyone has to push in that direction to say that in a way that is not confrontational, is not accusatory. It's like, hey, we want to protect you, and we want you to re-engage, and we want you to come out of hiding. But we do need to just skew a couple of things because of the continued risk for COVID.
Can I add to that? Sorry, guys. I know as far as contact tracing goes, because I still assist with that our push from that angle is we want to empower the community to test themselves. Because as we pivot from pandemic to endemic, we need to give underserved and marginalized communities the tools necessary to address COVID-19. Especially because we know that they've been overly affected, but also some of our cultural practices where we get together often and in large numbers and we eat a lot of food. And so we want to, and this is a great opportunity for the CBOs to say, yes, you can still do these cultural practices, but here are some tools in order to ensure that when you get together, you're taking the steps necessary to protect your kapuna, your medically fragile, your keiki who are not yet vaccinated because they're too young. The other thing that I've heard at some of these events is treat it as you would a pregnancy test. So if you have an at-home pregnancy test, you are either pregnant or you are not. So you either have COVID or you do not. So quickly take that test. Especially if you're feeling any symptoms. So if you have a sore throat, if you have a cold, and then also get in the habit of staying home if you're sick. So just going to add that to the conversation, but I think that's a good opportunity. Gloria,
and this is Gloria. I'll add just a little bit more to this, and that there are opportunities that we are missing also. That talking story, opening the door and engaging with an OTC test kit. It will open the door for opportunities that are being missed. Number one, we don't know the health conditions of people and how severe, or their chronic diseases. So it opens doors about conversations on seeking medical care. Also, we're missing a gap of there are medications available if you were to get COVID-19. And putting out messages like that and giving parameters so that they know if they have COVID-19 and they have severe cases, there are medications out there. So we want to help to prevent hospitalizations with this also, but fill in some of the gaps that are also missing that I think for our underserved populations, it might be beneficial to have repeated messages, whether it be through social media, large platforms, news, general TV, or just one-on-one talk story conversations that may be at an event or going door to door also to share.
Great conversation. Thanks, Gloria, Telly, and Na'alahu and Tiffany. We'll have more conversations about this. I think it'll change. And I think we just have to give each other grace, and say like we all change along the way too, and be patient with each other. If we don't fully understand the messages, then how do we help each other, especially our communities, to understand it also? So regarding that, I forgot to mention that our third component is the translations. We're working with Department of Health, and we're going to be the main, we'll be partnered with Department of Health, but we'll also help with the translations part. And hopefully if you folks could tell us, we need more messaging, or now we're going to start vaccinating 6 months to 4-year-olds down the line, what kind of information you need, how, we have 21 translations to make. So, but what could we do? Or do you want something changed? What needs to be adapted? So we will be also that hub for translations. But we'll work with you folks, especially for those who's never done the messaging for your CBOs. We'll work with you on how to start that with your social media, with your print materials and whatnot. So one-stop shop now, right? So just let us know if we could help you with that. Moving along, we're almost done, but we have a lot more things to do. I'm gonna shift it over back to Tiffany for reporting and data.
This is will be fast. We'll schedule another meeting to talk about data reporting. Na'alehu, if you can give me, if you already have written down the suggestions for what tracking for social media and all that, if you can shoot that to May Rose, and I'll drop my email and just copy me, or May Rose can forward it, we can get that built right away. And then we'll schedule another quick meeting in short order for how to do all that reporting.
Perfect. Thank you. We'll get that done.
Mahalo.
Thanks, Tiffany. I work for the Office of Public Health Studies. I'm at the University of Hawaii. That's my other hat. I'm a researcher. So what I always try to do is I love working with communities and organizations to empower you folks of using your own data. So what I wanted to share with Department of Health is like, okay, we're going to give you a bunch of data, but we want our data back so that we could give it back to our communities, whether it's translated, whether it's more in simpler terms. But for example, if you're doing vaccination clinics in Maui, and we could track that, but we can see like, oh, certain pockets are not being addressed for vaccination clinics or any outreach. So if it's for a Marshallese community, we can say like, okay, MCO, could you take your data and share with them and say like, we need more representation in this area. We need more vaccination here, but we will also want to train you on what you could do with that data, because a lot of times the community voice is not there. So along with the data comes with the story. So hopefully we can do both of that with this grant also. So I wanted to share that with you folks. Yes, so next is the budget. Tiffany, back to you.
Yep. And so once we see all the MOAs come through and the attached budgets, we'll be able to see which items need pre-approval, and we'll get those processed right away.
Yeah, so thank you. We'll work with you folks on the budget. If you have any questions regarding the budget, we'll work with you on that. But please, give us a heads up. Don't be like, hey, Rose, I have a question. We have an event tomorrow. Yeah, I'm like, okay, how about next week? So please work with me, and we'll try to have a good system going for everyone. I'm going to share my screen now and have Ananda talk about the invoicing.
Hi, just real fast. I just wanted to make sure that everybody knows that you can send in your initial invoice as soon as that MOA is signed. So if you haven't already, please get those back to us right away. And as soon as we get those, we can process them and get the funds out to you and working. For future invoices after this first one, they will be due by the 10th of the month. It's fine to send earlier if you have them ready. And we will need the budget tracker with those as well. I will send out additional details about what's needed for those invoices within the next week or so. If you have specific questions already, you're welcome to email them to me or to May Rose, and we'll get those answers to you right away. And then, as I said, within the next week, we'll have kind of a reference sheet that has all of the details for you to use with your future invoices. Other than that, let me know if you have any immediate questions. Otherwise, holler at me if anything comes up along the way. Thank you.
Yeah, thanks, Ananda. So Ananda's email is ananda@hifi.org. If you already have questions regarding invoices, please send it her way, or you can address them now. Do you folks have any questions regarding invoices right now?
I have one.
Who's this?
This is Jendrick.
Oh, Jendrick. Go ahead, Jendrick.
Well, first, I would like to say good morning, everybody. And I wanted to say thank you for the opportunity. But I got a question on the billing of the 10%. Can we, so we're gonna bill for the 10% for the overall award. But what about, so can we also submit two invoices, one for the 10% for the overall award? And can we put in for the 10% for the overhead for the for our organization at the same time?
So Colin is
Ananda or Jess, do you want to address that?
Wednesday the 6th. Also, Rose, there's somebody who I can hear over Jendrick. I'm just letting you know I can't really hear Jendrick well because someone else is unmuted.
I think, sorry, who's this speaking? So what Jendrik was saying was, can he bill for the 10% now invoice and then another invoice for the overhead? Was that, did I get that right, Jendrik? Yeah, okay. So Jess or Ananda, do you want to answer those questions Jendrik had?
I can offer from the Department of Health side for that.
Okay.
So since this is a reimbursement for CDC process, CDC rules on it, we would the only thing that's allowable is that 10% advancement, because even for the indirect fee, that's a reimbursement for what the agency put out. So with each of the bills that is reimbursement, then the indirect can be added incrementally, you know, or if there's one big purchase, you can add the indirect after that purchase was made, but the indirect can't be advanced because it has to be services that are already performed, at least from the CDC and Department of Health perspective. If HIPHI wants to advance that, that certainly would be up to HIPHI, but in terms just from state and federal, that's how they would view that. We and they. Does that help?
Does that help, Jendrik? Or do you want to add to Jess? Go ahead, Jendrik.
Okay, well, I mean, it helped. Well, it helped cleared everything out. But the reason why I was asking is because the 10%, it's the 10% overhead. It's a line item of itself, and we don't spend that 10% right away. So we would submit for everything else. And how would we submit for that 10% if we're only using the proposed budget, and then the 10% is a different line item for that? And the reason why I was asking for it, is because if we submit due to the spending that we're doing, but how will we submit for the 10% when if we did everything within our proposed budget? And how would we submit for that 10%?
Yeah, that is a good question. And I know it doesn't, thank you for clarifying. My answer doesn't help the money, but it helps clarify. So I get that. So what we would do is you would do the 10% to, you know, get some cash flow into the organization and make those purchases. Then your invoice number 2 would be say, okay, we made these purchases of $5,000 or whatnot. But then you can do your indirect in addition to those $5,000 and do that line item as an indirect for that invoice number 2, because being that it's an indirect, we don't know how the organization uses the money, but the organization, we can see they put forth the effort. It was, you couldn't do a line item, this is how much hours somebody spent on ordering because I'm putting this in the indirect. So we know that those activities are being reimbursed for the effort of administering that contract. We just can't advance the whole indirect in the front because the advancement is that 10% line item. Now, for example, I'm going to go more complicated just to confuse people. I'm sorry. If you take that 10% advancement and you decide to put that all into the indirect, you know, that's discretionary. You could do that. But then you would be, the organization would be pulling from their own funds for those purchases and reimburse. So I don't know if I see a couple head nods, so I'm glad I didn't get super complicated there. But so long story short, add your indirect to any invoice 2, 3, 4 going forward. That's what my recommendation would be.
There's a few questions on the chat, and Tony, sorry, Tony, I didn't mean to ignore your other chat question. So you'll take 500 for the COVID testing. Okay, I'll make note of that. And then Tony's other question was, can we sign contracts now if all paperwork is in? So we will send you your memorandum of agreement now that the paperwork is in, and then we'll start the process from there. And then Susan's question was, how much detailed documentation do we need to attach to each invoice? For example, for personnel expenses, how much detail do you need when a percentage of a person's time is being allocated to the project? What is the process for line item changes?
Sure. I'll do separately. So for personnel expenses, the preferred supporting documentation that Department of Health and CDC likes would be like a copy of the, not the paycheck, but before the paycheck, where you'll say cost center 123, which is, let's say the organization's paying 75%, and then cost center grants paying 25%. That would be the best example of supporting documentation for personnel. We have learned that some systems are very complicated and it's just not laid out like that. And so if you don't have that type of system, we can approve like a memo on letterhead saying, with that information, here's the person, here's their job role, here's the salary, and here's the percent that's being paid off the grant. And we're confirming that there's no overtime, that was included in this for the reimbursement. So we can develop a manual letter, like an attestation, as we call it, on letterhead, but the preferred would be a screenshot of the payroll that shows the percentage that's going to the grant. And for the process for a line item change, I do defer first line to HIPHI, but from the Department of Health perspective, budget revisions is something that we deal with all the time. And so that is not a problem. We can submit the forms for budget revision. There are thresholds that we can approve just within the department. And then if it exceeds a certain level of threshold, we can get pre-approval from CDC. So budget revision, no problem.
Thank you. And we'll work with each of you if you have any questions specifically to your project, because I know everyone has a different focus and different line items. Jess, you have a comment?
Yeah, I just wanted to add a couple of quick things and then also ask Ananda to share one thing. But I just wanted to also let folks know that HIPHI is also operating on a reimbursement basis. So after we give this 10%, we also have to bill the Department of Health. So there's only so much that we can front as well. We did get, just like you folks, we got a little bit upfront to help with this. But so bear with us as we're all working on a reimbursement method. It's not just you folks. With the budget revision, because of the way our budget is with Department of Health, hopefully it's not going to be too difficult for the budget revisions, but we would request if it's going to exceed 10% of your total budget to move something, that you ask for pre-approval so we can just make sure. And then lastly, I wanted to mention that it is a really fast timeline, and sometimes more money always is welcome and great, but it can be difficult to actually spend in a short amount of time. So we will also be kind of trying to track and make sure that it's being spent in a timely fashion, because we don't want to get towards the end and realize a couple of organizations have a ton of money left that they're just not going to be able to spend, because we can help to reallocate resources as well if needed and amend contracts. And then lastly, I wanted to ask Ananda if she could just maybe mention if there's anybody who did get an MOU that's waiting for their signature right now. It does come through DocuSign, so sometimes it might get filtered into spam. So if you can just mention so folks can, if you search your emails by DocuSign, it should pop up.
I'm sorry, I don't have at my fingertips who specifically sent them in, but I will double check and I will send out notes to anybody who has it sitting somewhere in their junk folder, and try to get those back right away.
And then once I sign it, after you've signed it, you should get a completed copy as well. So you'll have an executed copy that would get emailed, but that could get filtered because it comes from DocuSign.
Thank you. Great conversation. We're down to the last minute, so I'm going to say this really fast. Next step. So of course, please, for those who haven't submitted all their things, please submit it so we could get your memorandum of agreement and get that DocuSign going. You'll also have information coming your way regarding a quick reference update that Ananda made. Like it's just a sheet with all these numbers and links, so you can have it all on one page. I'll send you a contact sheet for HIPHI and Department of Health. And then also we're going to have those forms ready for the COVID tests, CDC approval for incentives and events. Also the meeting announcement that's coming up in 2 weeks, and then more grant information. If we have to send you out information regarding reporting or whatnot, we'll send it that way. I'll be your main point of contact. Please contact me. This is my email. And also Cyrell, when she starts on Monday, don't email her just yet. You can email me all and email me some good recipes and jokes too. But and then contact my HIPHI number. But if I know someone already mentioned this, like, oh, you called and it's from University of Hawaii, or it says Hawaii State government. That is me, because I'm calling from a UH phone sometimes too. So please don't hang up on me. This is it, 10:30. If you have questions along the way, please reach out to me and I'll try my best to answer them along with Department of Health. I know I already have some questions coming my way regarding your grant specifically, but hopefully this is the start of many meetings. Thank you so much for your time. I appreciate you all. It was great to meet you this way, and hopefully we get to meet down the road. Let me know how I can support you, but looking forward to our partnership. Thank you. We're at 10:30. Oh my gosh. And we'll keep in touch. If you have any questions, please email me. Thank you so much. And I'm excited to work with you all.
Thanks all.